Okay, good morning. It's Healy from What's the Bottom Line? And it's our first broadcast today, and I have the great pleasure. I have Dr. Matt Bambling, a biochemist and a well-recognised psychologist. And I'll just hand it over to you, Matt. Just explain to us in a brief form what your background is and your research, and then we'll go on and say what the actual subject of this interview is going to be about. Over to you, Matt.
Thanks, Graham. It's a great pleasure to be with you today. As Graham said, my training's in clinical psychology, and that's certainly something I've stayed very active with. I've got a senior university position where I do teaching and research, but my research interests at recent times have really gone down the molecular medicine pathway. So I like to think of myself as a molecular bioscientist in that way. We've been looking at working with treatment-resistant depression, and that's basically people who don't get better no matter what you do, whether having therapy or antidepressants. We're looking at some of the pathophysiological mechanisms why they do not respond to treatment, which is sort of down to the cellular level of what's going on in terms of inflammation and energy production in cells. That's my current research project, but I've got a finger in lots of pies across a lot of areas. Back to you, Graham.
Okay, thanks, Matt. Now, one of the reasons why, if you go on to Healy's lower back pain and you go on to the longevity and anti-aging page, you'll see Dr. Matt's profile there. Also, his link to his research. I suggest that you have a very careful look at that. And his research goes into the gut health and etc. But this is not from a marketing point of view. This is from a research scientist point of view. And I find that in my particular case, I'll give you a little bit of a case with me. I went and got a blood test probably about 4 or 5 months ago, and I didn't feel 100%. Normally, I'm quite fit with my background, as you know. And if you want my background, go on to healyshealth.com or healyslowerbackcare.com. A little bit of background on me. I'm currently completing my bachelor in science/chiropractic. It's my 4th year at university doing that, plus my other qualifications, which you can go onto the website. We won't go on about that. Now, what happened with me is I went and got a blood test. I didn't feel right. Something was wrong within my body. And my doctor, who's a very good Asian doctor that I've had for 20 years, she recommended that I go and get a calcium scan or CT scan for a calcium score. And they discovered in the blood test that I had low thyroid or hypothyroidism. Now, we adjusted that, but because I'm a health fanatic, really, and I'm very much into natural health, as is Dr. Matt, what I did was followed the my medical doctor's advice, and then I supported that with natural supplements around that. And the net result of that within a 4-month period was that all my cholesterols and everything had normalized. And within another 6 months, I'll probably get another CT scan to check the calcium scores out. Now, mind you, the calcium score that I did get was plus 400, which is sitting in the mildly, it's sitting up, there's a red flag sitting up with that one. So had I not done this and followed what Dr. Matt had suggested to me as a support system, it's quite probable that I could have been one of these victims who had a sudden heart attack and didn't know anything about it. Just motored along, feeling good, then bang, one day it hits you. Now, if you want to go into that, on this page, there is a very good movie that's recommended by, let me see here. Well, anyway, the movie is The Widowmaker, and Ivor Cummings, that's right, Ivor Cummings is the one who's recommended that. I suggest that you actually have a very careful look at that, and it'll sort of demonstrate to you that for our own personal health and fitness and longevity, that we've got responsibility for ourselves. And I would strongly suggest that we objectively look at the systems and the so-called institutionalized advice, and you've got an ability to wrap around the institutionalized advice, what probably natural products can support that. So over to you, Matt, on the subject of, let's start with the calcium scores that I got so that you can elaborate on that.
Well, Graham's calcium scores were very high, and as he suggested, he was at high risk for a cardiac event within the next few years. And certainly one of the things we observed was probably what's referred to as metabolic syndrome, and people just say, I'm getting older, put on a few kilos. But you notice a lot of things like lack of mental clarity, thyroid's not functioning well, adrenals aren't functioning well, metabolic hormones are low, blood pressure's up, blood sugar's usually problematic. And I guess the thinking around heart disease has moved, it advanced a lot beyond the allopathic medical approach. And I think the medical profession is catching up. And they would automatically say, well, go on some statins and take some thyroxine and that'll be enough. The traditional view of medicine is that you cannot reverse calcium deposits. I mean, they have a role. I mean, when a calcium plaque has stabilised, it's plugging the damaged artery. It's a healing attempt from the body to seal up a damaged piece of artery to stop the lipid core from exploding out and causing a heart attack. Mm-hmm. Yeah. So that's not a bad self-protective mechanism. But, of course, as calcium grows, it's a proxy indicator of extensive arterial plaque. So the stable calcium is not the problem. It's all the other stuff that's going on. What Graham decided to do was to take a bit of a slightly different approach, and he certainly conformed to what his doctor said, and that was a good thing because there's a role for statins. Blood pressure is another big one. You have to muck around with that. And thyroid, of course, if our thyroid's low or too high, our metabolism's not working properly, that's a risk factor itself for negative health events. But Graham began thinking about this from what does the longevity science teach us about metabolism and cellular function, and can we kind of begin to trick ourselves into thinking they're younger and behaving like they're younger? And there's a couple of things he did to really develop that pathway. The first one was looking at the research around a diabetic drug called metformin. Type 2 diabetes has been around forever, incredibly safe. And what is becoming more common knowledge about it is its action is because it's a very strong stimulator. It's a Turing class of genes. So it's a weak inhibitor of mitochondrial complex 2. And the cell reads out as an energy deficit, so it starts pumping out more AMPK. Everything works better. The longevity genes switch on, cells become more efficient in how they work. Potent anti-inflammatory action shuts down a lot of mTOR reactions, which you don't want to get rid of totally because it has a role in immune function. So that chronic inflammation we see with metabolic syndrome really starts to settle down. The other thing that's been shown to do, there's some emerging evidence, and I think it'll be shown that it probably does assist in the regression of coronary plaques. Although the evidence at this stage is a little bit undecided. Graham also then added vitamin K2, and there's reasonable evidence that vitamin K2 can assist with regression of calcium. And it's also very important for arterial health for all sorts of other reasons. The metformin and K2 are a nice combination. The other thing that people find when they're on metformin is metabolism starts to correct, so they tend to lose weight. They're not as hungry. They feel like a more constant sense of energy. The problem for most of us out there, if any of the people are listening and thinking, gee, where do I get metformin? It's a prescription drug. It was originally developed from the French lilac, so it was a plant-based compound. It's now made synthetically. It's very, very cheap, but medical doctors will prescribe that for things like type 2 diabetes, unless they have a very open mind and very progressive and understand the research for use in other conditions. Metformin most likely reduces the risk of heart disease. It certainly has been shown to reduce the risk of cancer. It's been useful in cancer treatments. It's possibly useful in reducing the risk of Alzheimer's and a host of other diseases, including the issue of blood sugar. The good news is there's another plant compound out there which works equally as well. I've looked at the literature on this, and the effect is quite equivocal. If you take this other plant-based supplement, it'll work about as well as metformin and lowering blood sugar, and it works on essentially the same mechanisms. It has an added benefit of doing a couple of different things. One of them is the upregulating of LDL receptors on the liver, which may in fact lower your cholesterol as well. And that is called berberine, and you can buy it online or in some health food shops. It's not ridiculously expensive, and you'd be looking at taking probably a minimum dose of between 1,000 to 1,500 milligrams a day. Some people use 2 grams a day. And that's very safe, and the toxicity studies have shown it's very safe. It will get you there with what metformin will do.
Just on that, sorry to interrupt there, Matt, but just on that, I followed that exactly. My doctor was happy with the metformin solution. However, I also supplemented with, at a later date, I supplemented with exactly what Dr. Matt said, the berberine. How do we pronounce it, Dr. Matt, again? I always stuff this up.
I call it berberine.
Berberine. Okay, so berberine. And what I found is, as Dr. Matt had detailed in his overview just then, that the AMPK side of it, and we don't want to get too technical of this, but I have got a video on that page on what actually AMPK, which is an enzyme that actually is a master regulator of metabolism. So, it fits into a big biochemical picture, but I've put a very simple explanatory video on the site, so that basically, you can study all the science, but that's great. We can explain it to you. But what I do is I go to people such as Dr. Matt or other people such as Ivor Cummings, etc., that people who spend a lot of time and research doing these things. And so we link into that and go, okay, right, let's hear the bottom line, let's hear the explanations, and basically trust their ability to do the research. You can do it yourself, but not all of us can be a full-time science, Dr. Matt. Is that correct? It takes That's a lot of it. For me, 4 years at university, for you, 4 to 6 years at university, doing all the research on the research, it just is a full-time job. So what you've got to do is rely on people who have what I call an objective, out-of-the-box mindset that can look at the big picture. And fortunately, as I said to you originally with Dr. Matt, he's a big picture person. Now, the other question I just want to ask you, Dr. Matt, is, as we go down this road with what I call supportive healthcare around, it could be necessary medications. Like you said, in my case, for the first time in my life, my blood pressure was up. That normally never happens. So I had to go on a blood pressure medication. Now, the end story for this is I've got one blood test with my doctor, my lovely Oriental doctor, and all my blood tests on the second time after 4 months were absolutely normal. She wants me to go and get another blood test, but the object in mind there would be to go off the blood pressure medication if my blood pressure is normalized. I know it's been normalized now for about 4 months, but the object, the exercise, is the necessary medication, such as the thyroxine for the thyroid gland. And there's not much I can do about that. I've got to be on that. But if my weight comes down, like I've lost almost 12 kilos of body fat, and a lot of that visceral fat, and Dr. Matt will explain that in a second with the low carbohydrate, high good fat diet that we're promoting on the page. But so my medical doctor said, well, okay, Graham, look, I've got a funny feeling that there's going to be a younger you coming out of all this, because she knows of my fitness background. But in my head, I thought, God, things are slowing down. That's what I thought. But then when I followed Dr. Matt's advice regarding the metformin and the berberine, and other support supplements such as ALC, krill oil, vitamin C, vitamin D, vitamin K, we did a whole package with it, what I call a support package. That all worked. And then I found that I was honing down again, getting back to my You know, I'm almost at my 85 kilo level, which is my super fit level, which has been very difficult for me to get back down to, bearing in mind that I'm 65 years of age. A young 65, I must admit, Dr. Matt, but still a lot of people my age, they're just over the hill, and because of that metabolic syndrome that is it's not really understood well. And, you know, God bless the medical fraternity, but what we're finding, or what I'm finding, I'll say this, is that each particular health discipline just looks in their particular box. So they'll look at this particular aspect and they'll follow that particular advice, but trying to integrate the whole picture into a personalized, you know, this is that's happening, and look at this, and this. And just as Dr. Matt said regarding the contributing biochemical factors in your metabolism, if you go and have a look at the video on AMPK, you'll suddenly understand there is a whole synergistic series of events that affects one thing. And what Dr. Matt was saying, that what he's discovered, and certainly from the research he's done, and correct me if I'm wrong here, Dr. Matt, is that the metformin is basically a facilitator to tune up the body's cells and the receptors so that you have better insulin the insulin resistance is a big factor in metabolism syndrome. So could you elaborate on the insulin resistance?
Yeah, I mean, that's a really good point to raise. When we're thinking about things like heart disease, aging, and aging is really just collective damage over time. Systems start to fall out of homeostasis, and it's kind of pretty sad, and cells start not to respond well. Probably, as an endpoint, inflammation is a result of all interruptions or problems in the system. High circulating insulin and high circulating glucose is an important cause of a lot of metabolic syndrome. It's probably a significant cause of atherosclerosis and, if you like, heart disease. It leads to other things like, impaired methionine metabolism, where people have too much homocysteine in the blood, which damages arteries, and C-reactive protein is often up, and that's an inflammatory marker, and you can guarantee people with high C-reactive protein, they've got endothelial damage of the arterial linings. And as Graham said, the research is kind of making a pretty compelling case that if we want to be healthier, have less risk of all diseases, protect our arteries, we should not be eating excessive carbohydrate to keep our blood sugars in a nice balanced range and not spiked, and not have excessive insulin trying to drive it into cells. Metformin sensitizes cells to insulin. They just start sucking it up again. That's not always enough for some people. They certainly improve. Moving towards an idea of eating, which people have heard called by different names, keto, Mediterranean, there's a variety of ways of thinking about it. Essentially what research has been to show that if people restrict their carbohydrates, not greatly, but restrict it to modest intake of carbohydrates, not excessive protein, but adequate protein, people who are athletic and exercise need protein, and because excessive protein can actually spike blood sugar, and in life get a lot of energy from fat. And it sounds counterintuitive because we've been taught for years, fat's the enemy, stay away from it. But think about how people would have lived in the past. They would have eaten a pretty high-fat diet. They would have scrounged around for whatever veggies and fruit they could find, and would be eating plenty of protein. And so it's hard, it's interesting if that's the way we're kind of designed to eat, what's actually going on with this kind of diet. And what tends to happen is we make more ketones, and we haven't got adequate carbohydrate to fuel everything by carbohydrate. The body has a dual system. You can burn carbs or burn ketones. And in fact, your body makes glucose, even glycogen in the liver, and it can make it from glycerol and other things. So it can turn protein into glucose. It's one reason not to eat excessively huge amounts of protein, because you'll actually could spike blood glucose. Insulin has more of a response to a very high protein hit than it does to fat. It's almost non-responsive to fat. So these are interesting dimensions we can tweak biochemically. When we're in that state of ketosis, and there's a lot of controversy about this, people are very, very ill. You wouldn't want to try that talking to your doctor, and this doesn't suit everybody's metabolism, but it seems to improve a lot of people's metabolism. The energy organelles of cells called mitochondria, where all the energy is made, improve. They start to function better. We've got metabolic syndrome, we've got mitochondrial dysfunction. People start to grow more mitochondria. Neurogenesis, brain cells start to sprout more regularly. It's very, very interesting. People subjectively report they have more constant, even energy. They have find their memory and their focus is sharpened up, and they're not getting very hungry. They're feeling a cessation or being full. There's a very pleasant feeling of not wanting to eat. If you're a carb addict, you're probably looking for food an hour after you've had something, and just when you finish breakfast, you're thinking about lunch. In ketosis, you probably won't give food a second thought until lunchtime. And people marry that to things like intermittent fasting to increase a process called autophagy in the body. When we haven't eaten for a certain period of time, what tends to happen is that our body moves into a state called autophagy, where we start cleaning up damaged proteins, and apoptosis, where it starts to kill damaged cells. And the body starts moving to that really repair and growth mode. Human growth hormone goes up. All these sorts of things happen. And there's some evidence in a funny kind of molecular way. You can actually make yourself younger. If you want to go a few years back, skip a meal. Yeah, skip a meal. Let your body get into autophagy. To manage hunger, people use things like, as Graham said, some nice fats, the omega-3s, and you have a little bit of 6 and 9. Don't want to overdo 6 and 9. Medium-chain triglycerides are great. They converted straight to ketones. They have to be processed by the liver, where the other oils do have to be converted, but you still get ketones, you still get there. And that gives you a nice feeling of energy and clarity, and you just don't feel hungry, and you can go to extend your time of fasting between meals. And some people suggest like an 8-hour window or a 6-hour window where you eat. So you don't eat the rest of the day. You might have, say, lunch and dinner, lunch at 12, dinner at 6. Some people eat once a day. Some eat 3 a day and so they don't want to fast. But either way, it would seem when people are ensuring they haven't got excessively high insulin or blood sugar, everything just seems to work better in the body, and you probably are adding years to your life by doing so. And if you have health problems, you may well notice that these things start to improve, and particularly for people who've got insulin sensitivity, metabolic syndrome, they often notice dramatic improvements. Once again, if you're unwell, do that in conjunction with your GP. You just need to be monitored because, we can't give medical advice in this forum. So you must see a health professional.
Just a slight interruption there, Dr. Matt. We've got 5 minutes to go. What we've decided that these broadcasts from Healy's what the bottom line is will be kept to 30 minutes. Apart from the fact that that's a Zoom cut-off time anyhow. However, on those good fats, bad fats, Dr. Matt. Just elaborate a little bit on, when people talk fat, straight into their head goes, fat sitting on the side of a bacon and eggs or something. Can you break that down? When we're talking fats, I always say good fats because we're covering the omega-3, 6, 9s and those relative, and the thing is that polyunsaturates and monounsaturates have a different chemical structure. And we've got that covered on the web page. And the biochemist Udo Erasmus, who's written the book Fats That Heal, Fats That Kill, goes into that with great detail. I suggest you buy his book and have a look at it. He'll reinforce a lot of stuff that Dr. Matt's talking about. But Udo wrote all this in the 1980s, would you believe, when, who was it, Dr. Matt, the Atkins diet was around, where Atkins just focused on proteins and saturated fats more than anything. He didn't go into much more detail. However, as I say, Dr. Matt, can you just elaborate on what sort of fats we're talking about? And the thing is that what Dr. Matt recommended to me, he said, push your fats up to about, this is in my case, I'm 90K, and I was 103K. push your fats up to about 100 grams a day. And I said, how the hell am I going to do that? So what I did is I purchased a bottle of Udo Erasmus's oils, the 369 combination flaxseed and that, and I just have a couple of teaspoons in my coffee or my green tea, and boompo, next minute I'm up to 100 grams a day. And as Dr. Matt said, the energy level's there. Your system cuts over to ketosis. You do take a little bit of carbs. We worked out that probably, in my case, about 50 grams of carbs is enough. And keeping the body in that state of renewal and repair is a big bonus, a big tick in the box. So back over to you, Dr. Matt, with the good fat scenario.
Yes, I'll just make a couple of comments because I'm out of time, but
Yep.
certainly if you want to use oils like that, empty tummy with a coffee or a tea is the best way to go, so it can be processed quickly. Omega-3s are incredibly healthy. Your cell lipid membranes will take them up preferentially to any other type of fat, and that keeps them supple and they can kind of transport things. Omega-6 and 9 are important. Don't want to overdo those. They're all good fats, our nuts, our Udo's oil. MCTs are medium-chain triglycerides. While they're saturated, they work differently to some of the other types of saturated fats. They're also very healthy. And you can certainly have a smaller proportion of normal saturated fats. Research is kind of showing that it ain't going to kill you, and you can still enjoy a piece of bacon and an egg. I think that we might be out of time, Graham.
Yeah, that's it, mate. Bacon and eggs, and we're just the good fats is the news. Thanks very much, Dr. Matt. We'll wrap it up. We've only got half an hour. We'll continue on with part 2. And if you like the conversation, just hit the like button below when I get that up. And thank you again, Dr. Matt, for your valuable time, and appreciate it.
Pleasure to be with you.
Okay, thanks, Dr. Matt. Have a good day.
Thank you. You too.